Good morning and welcome to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, and this morning we're going to give you a bunch of amazing, unique ways that you can look your best and in turn feel your best. Good morning, Dr. Flaharty.
Good morning, Gina.
Dr. Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas. He's got 3 offices in Fort Myers, Naples, and Bonita Springs. And during the breaks, you can find him online at azulbeauty.com. But don't do it right now. We want you to focus on what we're saying.
Yes, absolutely.
I mean, you can go and get some coffee or something. But
coffee is good.
Yes. So we've decided to talk to some of the people today who've used and benefited from so many of the services that we've talked about, week in and week out here on this show. And it's just sometimes it's just nice to hear from somebody who's been through it. I mean, you tell people every week what to expect, and but when you hear it from another source, it's like, okay, that person sounds like me, and I feel more comfortable that I can do that.
Yeah, I think it's great to hear from patients. I always find that to be very informative. I hear things.
You learn something too, right?
Absolutely. Every time. So it's good. So, yeah, I mean, one of the big new trends in facial cosmetic surgery is non-surgical, what we call the liquid facelift, or at Azul, we call it the Azul liquid facelift. But really, a liquid facelift speaks to using injectables to rejuvenate the face. Those would be Botox products, Botox, Dysport, or Xeomin, and fillers. And there's too many fillers to list nowadays. There's so many available.
Right.
But the concept is, Botox has been around since the 90s, and we know that can reduce frown lines between our brows and the horizontal lines on our forehead and the crow's feet around our eyes, as well as reducing some of the changes around the mouth, like vertical lip lines. But fillers really are what transform this into a really powerful treatment, because so much of aging is volume loss. We lose volume from our face with age. We lose a lot of fat. We also have the muscles shrink and the bones resorb. And so our face becomes more hollow with age. And you can see that if you look at the face of a grandmother versus a teenager. The difference in volume is obvious. And so now we have these fillers, which are really like, sculpting of the face. We can now replace lost volume. And so, in the beginning when we started using fillers, it was sort of for lines and creases around the mouth. But now we pretty much put them everywhere. We can fill in hollow temples, and we can lift the brows. We can fill in dark circles under the eyes and lift the cheeks, restore sort of that volume in the cheek, which is a very powerful treatment, as well as jawline, and as well as creases around the mouth and even the lips. So, we find now we're using fillers all over the face to kind of reshape the face, and it's all done non-surgically in the office. Right.
It just freshens everything up, and it kind of buys some time before you have to do anything a little more advanced.
Right,
say.
Right. And so, people have been coming in for Botox, and I'll admit, I've been using Botox for over 20 years, and nowadays, I probably do it probably once or twice a year. Usually one of the girls will catch me and say, yeah, your frown line's starting to show up again. But when you start using it a lot, actually you don't need it as much, because the muscle relaxes, shrinks down, you break the habit. There's a number of things that happen that prevent that crease from coming back as fast once you've done it a few times.
Right.
And so, it's not like you have to be married every 3 or 4 months. That's typically not the case. In most cases, once you get it under control, you can space out those visits. But then the fillers have really kind of exploded, because now you can do, really reshape the face. And so now we have these really powerful tools to make you look younger with little or no downtime in the office. And they can be done gradually over time, which is also a nice thing. You don't have to do it all at once. You know? So nowadays, what used to be just a Botox visit now is typically a Botox filler visit. Many patients come in about every 6 months, and we'll do the Botox, and then we'll just look and see where they need filler. Maybe it's the dark circles under the eyes. Once that's filled, typically they don't come back for many years, so you don't have to redo that. Maybe it's the mid-face, like lifting the cheeks or treating some of the creases around the mouth or making the lips a little plumper. But we're not doing the same thing each time, because it does last longer and longer.
Nice.
So that's what's fun. You're actually building on success.
Okay. Well, we've got Susie in with us this morning. Good morning, Susie.
Good morning.
Thanks for being here.
Thanks for having me.
So you've done the liquid facelift.
I have.
So tell me about when you first started. Let's start with the Botox, because that kind of seems to be the thing that people will dip their toe in the water with first when it comes to anti-aging treatments.
Sure. I started about 10 years ago with the Botox.
And what made you do that? Did you look in the mirror and say, oh, I look angry, or I don't like these lines? Or, what was it that spurred you on to take the action to get something done.
Yes, all of the above. So that is the correct answer. I had some lines in between my eyebrows and forehead and on the sides of my eyes, and I just wanted to relax them a little bit and not create deeper lines as I got older. So,
and then when you first started, did you do every 4 or 6 months? I mean, or how did that work for you? Because I know everybody's different.
I think I started out, because it was 10 years ago, doing it every 4 or 5 months for the first year. And then I got out to twice a year. And that's about what I do now, twice a year. So every 6 months.
So that's not commonly known. Most people think, oh, well, I don't want to do Botox because then I have to come in every 3 months. And, perhaps the company and maybe many providers want to have you think that. But the truth is, after you've had it a few times, and it does take a few times, so coming in every 3 to 4 months for the first few treatments is important because you're basically keeping those muscles at rest. Imagine if you have a broken arm and you put it in a cast for 3 months. When you take the cast off, that arm's smaller than the other arm because those muscles shrink from disuse. So same thing with the Botox. You're really shrinking those muscles, and then if you do that effectively, then they're not going to come back as fast. The creases won't come back as fast. So you can space it out. And we find that to be pretty universally true. You don't have to be married to a 3-month schedule. You can stretch it out a little bit. So it's more cost effective.
So I know that, in talking to people, one of the things that is their big concern when it comes to Botox is I don't want my face frozen. So what was your experience with that, Susie?
Well, my face was not frozen. I think that's probably too much Botox. But for me, I just wanted to kind of relax those lines. It looked very natural. Dr. Flaharty has done it, for me. And previously to moving to Florida, I had it done. And I just wanted a natural look.
Because technique is very important with this. You don't want those arched eyebrows or a surprised look that sometimes, if the Botox isn't put in the right area, that muscle will kind of act up, right?
Right. Yeah, it's not an all or none phenomenon, and it's very individualized. And to me, again, the perfect result is one where it looks, softer and smoother, but you do have some animation, and you can see looking at Susie's face, there's no real wrinkles.
You're moving.
But she does, she can lift her brows and smile, and, she looks very natural. And it's always interesting if you watch TV, I've seen some Hollywood stars interviewed where there's no movement of their face. It's just frozen and it looks very unnatural, Right. And I remember one in particular, they were interviewing her and then they were showing her clips in a movie. And in the movie, she had this movement, but then in the interview, there was no movement, because her face was kind of over Botoxed. And so I think that's a common problem. And it isn't, all or none phenomenon. It's how much you use and where you use it that determines the result. And so there's a lot of aesthetic judgment with Botox.
And Susie, when you decided to do fillers, tell me about that.
So that was a few years after that. I've been doing filler probably once a year for the last 6 years.
Different spots each time, or?
Yeah, I mean, my cheeks had lost a lot, a little bit around my mouth area, lip lines. You can do temples, things like that, if you're really, really hollow. So mostly for me, it was cheeks, around my mouth area, and lips.
So could you feel the fillers?
No, if they're, in my opinion, if they're done right, I don't feel them. They look natural. I've never had anyone tell me, you look overdone or anything. People are just like, wow, you look good for your age,
Then
good. I'm like,
what do you mean for my age?
Yeah, I'm like, what are you talking about?
Just good. Just good.
Yeah, just tell me I look good.
Yeah, so fillers, again, same kind of thing. It is very individualized. The mid-face lifting is great. That's a great treatment. Now, obviously, you can see Susie looks beautiful. It's hard to tell, where the filler is because she has naturally full cheeks. They look very natural. And same thing around the mouth. She just has, a naturally beautiful face. And some, a lot of that's her own natural beauty. And some of that is just fillers to make it look the best
Enhance
it can be.
it.
Right. So that's it. So aesthetic judgment there, too, which is really what makes it fun. I mean, I find it very artistic, just like in surgery. I enjoy the days in surgery, but I do enjoy the days in clinic, doing Botox and fillers, which we do more and more of all the time, just because it's very popular.
So, Susie, this is kind of like one of those instant gratification things, too, the fillers, right? I mean, you can look in the mirror as soon as it's done and go, wow.
Yeah, absolutely. And that's why I love coming to Dr. Flaharty, because he's very natural in his approach, his technique. You look really, natural. After it's done, you don't look over blown up or anything like that. So when you walk out, when I walked out, I had a little ice on my cheeks, and that was it. I didn't work out that day.
Right. Took it easy.
I just took it easy, but it looked great the next day.
Did it hurt?
No. I mean, filler, to me, I don't think filler is that painful.
It's just a little injection.
It is, but around, if you do your lips, I have to say the lips are probably the worst part that I felt. But, you know, they do use numbing cream and things like that, so sometimes that's all you need.
Numbing cream helps a lot. They are injections, so you will feel some of them. With the new needles for Botox, since I do Botox, it's amazing. About half of those injections you don't feel at all. Right? And the ones you do feel are fairly mild because it's very thin. Fillers, some of those you'll feel a little bit more, especially when you get around the lips. But the numbing cream works very well. So, we haven't had people say, I'm not going to come back and do that again because it's too uncomfortable. I mean, that virtually never happens. Yeah. So, the results definitely way outweigh the discomfort. They are injections, so we do have people use ice afterwards, and there is some risk of swelling and bruising, so obviously avoiding blend thinners if you can and those kinds of things. So we say, no downtime, but it's really minimal. You want to use ice that day. As Susie mentioned, we don't want you working out that day. And then if you need to use makeup the next day, you can. So
real quick, Susie, you said the lips, didn't you? Said that was a little discomfort. Was it during the process or during the healing?
Just a little bit more. I could feel it during the injections.
Okay.
Otherwise, I held ice to it for, the first hour or two, and I was back to my normal routine.
All right. The liquid facelift at Azul. There you go. Thanks, Susie. Appreciate you coming in.
Thanks for having me.
All right, Dr. Flaharty, we're going to take a quick break, and we're going to have another guest.
Yeah, we will.
All right. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We'll be right back. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, and we're talking about the liquid facelift, the first part of the show today, and we're talking to people who've actually had it done. And Dina's in now.
Yes.
And so, Dina, you have done the liquid facelift here at the Azul Cosmetic Surgery Medical Spas.
Yes. Hi, Gina. Thanks for having me.
You're welcome.
I have.
So, Dr. Flaharty, when someone like Dina would come in and say, "Okay, I'm not liking the lines," or that, what was it that you didn't like first about your face and aging that brought you in to kind of consider the options?
Am I allowed to say everything?
So Dina would come in and see you, Dr. Flaharty, and then tell us how the process would be to deciding, okay, you need Botox and fillers.
Yeah, well, obviously Dina's young and doesn't really need much. She has a beautiful face. She's always taken good care of her skin and is kind of committed to that, which is great. Not everybody is, but it makes a difference. So really, just some of the expression lines. What happens is, we all express ourselves in different ways, and by the 30s, really, you start to see some of those lines showing up on the face, frown lines between your brows, or horizontal lines on the forehead, or crow's feet. So that's a logical entry point for a lot of people to come in their 30s or 40s and say, gee, I'm seeing these lines that are kind of always there in the mirror now. Is there anything I can do to treat them? And that's what Botox works great for. So, I don't remember, Dina, maybe you can share with us when you first got Botox, or about what age you were when you started that?
Sure. I think it was mid to late 30s, which may seem a little young for some to get started. But I think one of the things that, I know for myself and people around me, we're trying to also prevent future problems from arising. And so for me, it was about correcting the problem at the time as much as, educating myself and doing this for prevention for aging.
Right, because I've heard people say who are in their late 20s, oh, I've got to go get Botox. And before I was educated more on what Botox is and does, I kept thinking, you are out of your mind. You're in your 20s and I'm in my whatever. And I'm like, I haven't had it done. And then, once I've started talking to you, it makes sense. When you start seeing the signs, so you can nip that problem before it gets worse.
Yeah, if you start early, then you never have the creases. It was funny. I had a patient say to me, yeah, my friends say, why do you go in for fillers and Botox? You don't need anything. And she said, that's the point.
Yes,
It's
right.
like you're missing the point. I do it, and so I don't need any. I look great because I do. And one of the things that Botox does that people don't often recognize is that it actually shrinks the sebaceous glands. And so as we age, our sebaceous glands get bigger, and that's sometimes people say, oh, I have these large pores in my skin, which is often related to those sebaceous glands. And so somebody like Dina, who has nice skin and has really taken good care of her skin, patients like that who pride themselves in nice skin really love the effect of Botox in further smoothing the skin by shrinking those sebaceous glands. So it really smooths the skin quite dramatically. There's actually some treatments, and a doctor in China has developed a technique where he just injects the Botox into the skin, not even into the muscle. So he's not even trying to weaken the muscle. He's just trying to smooth the skin. Oh, wow. Which is popular for it's become popular in his practice just to help people have smoother skin. So you can get this double benefit. You can eliminate the line and crease, and you can smooth the skin as well. And a lot of people don't recognize that, and that's why people who do Botox generally have very smooth skin.
So Dina, I'm assuming then you've had the Botox like between your eyes?
Yes.
Forehead?
I've had it in the more common areas. So for me, between the eyes, the forehead, and around the eyes, where we call that the crow's feet.
Right.
So
because I know, Dr. Flaherty, you sometimes will do it around the mouth as well.
Yeah. So the most common areas are what Dina mentioned, kind of between your eyebrows, those kind of vertical lines. Sometimes the people call them the 11s. Sometimes people have one line. Sometimes they have three, but a lot of times there's two. Horizontal lines in the forehead from lifting your forehead. And then the smile lines, the crow's feet that she mentioned, which are just sort of the lines that start to show up on the outside corners of your eyes. Those are sort of traditionally the three areas we treat in a lot of patients. But Botox can be used subtly in other areas like around the mouth. Now, it's a little more difficult around the mouth because obviously we need our lips and our mouth to work normally for speech and for eating and drinking and all those things. So you can't just weaken, the mouth area and not have consequences. But small amounts. So if you purse your lips in the mirror like you're trying to whistle, you'll get these vertical lines on your upper lip. And we express ourselves in a certain way with that movement that leads to these creases showing up. And a small amount of Dysport can weaken the upper lip and smooth those lines out. So that's a really nice treatment that has to be done very subtly, though, because obviously you need normal function of your lip.
Right.
And then at the corners, sometimes we'll do it at the corners down by the jawline. There's a muscle that actually pulls the corner of your mouth down. It's called the depressor anguli oris muscle. And putting a little bit into that muscle will actually lift the corner of your mouth. We do a lot of fillers to lift the corner of the mouth as well, but Botox in small doses can help there. And then some patients will use it in the neck. Some of the vertical banding of the neck that we get with age can be softened. Some of the horizontal banding can be softened as well. So there's a number of other areas where it can be used just sort of in a subtle way to enhance the shape of the face.
So Dina, when you first came in, did you just start with Botox and then gradually start adding the fillers as time went on, or did you come in and say, I'm going to try it all, let's do it?
No, I have to say I started with Botox first.
Okay.
Yeah, kind of just get my feet wet a little bit.
That's kind of the way people start, right? With
well,
a lot of this?
And really, Botox was the first, and for many years people would come in and do Botox and skincare, that kind of thing, but not fillers, because all we had for many years was collagen, and it wasn't even human collagen, it was bovine collagen, so some people reacted to it. Reaction could be a little redness at the injection site for a few months. But the biggest drawback of collagen was that it just wasn't very effective. It was very thin and watery, and it just didn't last very long. I mean, it could really disappear in a matter of a couple of weeks. So not many people wanted to come in and have injections for something that was going to be very temporary.
No.
Yeah.
So where did you get your first fillers?
I think it was my lips.
So, see, that's the thing that I think a lot of people are most afraid of, because when you look at somebody who's been, quote, overdone, I mean, that's a very obvious spot, but you're like, forget it, I'm going to do it?
Oh, absolutely, yes. I think, some of us are just trying to restore what we had in youth. It's not necessarily about making them, what you would say overdone, extra big or anything like that. But, as time goes on, we do start to see, I noticed for me, just a little deflation. And I wanted to see something from, 5-10 years ago, back when I looked in the mirror, just to get a little bit of that back. And so the answer for me always is, it's not, completely erasing who I am or totally changing changing, but just, I want to be happy and feel young and stay young, and it helps me feel that way. So
I'm looking at her lips, and I couldn't have told that you've had anything done to them. They look very natural.
Thank you.
Yeah, they look great. So Dina, is younger, and that's a common, younger women in particular often like a little bit of enhancement of the lips, and obviously, I don't know what other areas we might have treated. Do we ever do any mid-face treatment? Yeah. So mid-face also, you lose volume in the mid-face with time. And so, again, you're restoring some of that volume. Like even for her, if it's 5 years or 10 years, just restoring that volume, it just makes you look a little younger and healthier, which is good. What's interesting is, as people age, when they get older, they're going to lose a lot more volume. And so then, you probably can't do everything all at once. You have to decide what the priorities are. But a lot of times we'll do mid-face, because that, I think, for the money is a great,
because it has a lot of benefits.
It's
for
a pretty big bang for the buck in terms of making you look healthier and younger. Once you've started to really lose volume and get hollow in the cheeks, it makes us look older and tired. And so restoring that volume with a few cc's of filler can really lift the cheek and give you more of a healthy, youthful shape to the face. But even as we kind of go through that and maybe add a little bit around the mouth for the creases, in older patients who often are kind of like hesitant about lips, we have a technique we call a mini lip lift, where we just do a little bit. And, if you look at the lip and study the anatomy, you have sort of, Cupid's bow in the center of the upper lip, and then sort of you have two pads, and one on the left, one on the right. And then in the bottom, it's sort of one continuous lip with more of the central pad. And so those two pads on the upper and the central pad on the lower, we just do a little bit in each of those, just 3 little injections. And it's amazing how that can look wonderful for somebody who's older, whose lip has really shrunk a lot over 30, 40, 50 years. With Dina, it's a small amount. She's lost a little bit of volume, and a small enhancement gave her back the volume she wanted. But it's, and the key is, again, not overdoing it. I mean, like everything, and now with fillers, what we see is overdone lips and overdone cheeks. And once you kind of get past that normal anatomic limits, it's not going to look natural. So you want to avoid that.
So, Dina, how long did the fillers last in your lips, or are they still lasting? I mean, can you still tell the difference?
Yeah, actually, to answer your question, good question. I do feel like that this has lasted a really long time for me, and so it's more than met the expectations. Yeah,
great.
It's been
as
a while.
we talked about with Botox, fillers, this happens too, and in the lips as well, where once you've done it a few times, I think your body starts to accommodate the filler better, and it helps create some collagen. There's several factors going on, but, often people can go a year, 18 months, 2 years without doing the lips.
That's worth it.
Yeah, and, it doesn't happen maybe with the first time, but with each successive treatment, it gets better and better, and that's true for creases around the mouth, too. So you do see some continued improvement with repeat filling. It's not like, you fill or do Botox and it just goes back to zero and you're starting all over. It's not that way. As long as you come back at least, ideally, every 6 months or once a year. But we, again, don't repeat the same thing over and over. And with lip augmentation, usually we wait a year, sometimes 18 months, sometimes 2 years. Just depends on how they retain it.
Right. And it was kind of like what you said with the under the eyes, too. It's similar there, because that can last. Did you have that done to your eyes? Were they okay?
You're going to laugh, but I did. And that's been one of my favorite things, too. I have to, if I had to make a list of everything, I love everything. And so for me, some of it, I time for events, for holidays and things like that. So a couple of the treatments aren't going to be done all the time. Like Dr. Flaharty mentioned, I just do it, once or twice a year or once a year, if that. So everything kind of is on this interval schedule of when you see things kind of start to go back down again. You don't necessarily have to let that go back down to zero before you come see your doctor again. Then, you can come in a little earlier if you like. For me, I kind of have them spaced out perfectly, but definitely before events is when I usually.
And under eyes can be a one-time event. I think yours was only done once under your eyes.
Yes,
yeah.
right.
And that was probably a number of years ago. And that's typical. It's rare that we repeat under the eyes. That typically will last several years, which is great.
All right. Dina, thanks for coming in this morning and sharing your experience. Dina. All right. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. We're going to take a break and be back with more testimonials. I'm Gina Birch. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We are talking to some of Dr. Flaherty's patients this morning who've been in and gone through some of the procedures and things that we've talked about on this show over the months and weeks, and I guess it's years now. And one of them is Kybella, and I don't really remember that we've spent a lot of time on talking about this. We haven't
talked a lot about Kybella, and you know, Kybella is a product called deoxycholic acid, and it's actually an injectable agent that is FDA approved for shrinking fat in the neck. So it will actually lyse fat cells, and it came out, right around the same time as Coolsculpting was becoming popular, and then Cool Mini came out, which was the Coolsculpting device to shrink fat under the chin. So we actually have two ways now to help reduce fat non-surgically under our chin. Me with Coolsculpting, the fat freezing, and the other is these injections of Kybella. So Cool Mini is obviously an applicator that attaches kind of to the neck and freezes the fat focally. And Kybella is an injectable where you inject very small amounts of this deoxycholic acid, which will then dissolve the fat cells and they'll gradually disappear. And interestingly enough, kind of in our practice, we have been involved with Coolsculpting for a long time, so we do a lot of Cool Minis under the chin. But sometimes the Cool Mini doesn't work under the chin, or sometimes people's anatomy isn't quite well suited for that, where you can't quite get the fat treated that you want. And so we've been using Kybella, in cases where the Cool Mini doesn't work. I like the Cool Mini, I think, a little bit better in general because typically I think there's less swelling with it. But again, and because not everybody responds to Cool Mini or isn't a good candidate because of their anatomy, it's great to have Kybella as another option.
Okay, and we are going to talk about Coolsculpting in the next segment a little more in depth.
Right, yeah, that's right. We'll get more into that.
Yes, but the Kybella, and when you say it dissolves the fat cells, does that mean that like the ones that it hits, they go away and they're not coming back?
That's correct. Okay. So it's a permanent fat reduction, which like Coolsculpting, which is important. It's not a temporary thing. You're not just shrinking the tissue. And it's been worked out where they give you there's a very specific pattern that you treat the amount you put in. And also like Coolsculpting, this can be repeated. So we do a treatment. You wait about a month to see the result, and then you can go back and do an additional treatment to shrink more fat. And I think, over time, this will be something that's certainly scalable because obviously when you think about unwanted fat in the body, there are probably a lot of areas as we talk about with Coolsculpting. So, I think Kybella is an interesting product that we might see more of in the future because it is effective.
But it seems like the smaller areas would be best suited for it because you are injecting, right?
Right. Yeah. And they would be areas that would be tougher to get at otherwise, too, that may not. I mean, it's sort of this, this race with Coolsculpting to develop these new hand pieces to treat more and more, fine little body areas. And that's been the key, is the number of new hand pieces to treat small areas. But with Kybella, obviously, you can inject it, really anywhere. So that's no limitation anatomically, really. Okay.
So Amy's with us this morning. And Amy, you've had Kybella done, correct?
Yes, I have. And I've also tried the Coolsculpting as well.
Okay. Well, let's talk about both of them then. So what was the difference, or why did you, I don't know, pick one over the other, or were you just trying to experiment and find what, like Dr. Flaherty said, is that attachment going to work for me? Or
yeah, she had a treatment with Coolsculpting, but just didn't respond. And Coolsculpting, not 100% of people respond. Okay. It's usually 90+%, but there's some people that seem to be a little resistant, or maybe you get some fat loss, but not enough to really be noticeable. So
is that kind of what happened to you?
Yes.
Okay.
So ultimately, she, moved on to Kybella. And go ahead, you can share your experience with the treatment there.
Yeah, so I had never really seen any results as far as diet and exercise with my chin. And it's something that runs in my family, and it's stubborn.
Just having a heavy neck or chin, just having that spot under there.
Absolutely. Okay. So I had the treatment done, and I would say within a couple of weeks, I noticed a significant difference within the mass underneath.
Did you have any swelling or afterwards initially? Did it get a little worse before it got better?
It did swell. Not as bad as I thought. It really wasn't that bad, but the results were just amazing.
Okay.
Mm-hmm. So then you mentioned you had 2 additional treatments after that to get further improvement in that. And did you see equal amounts of response with the others, or was it a little less because there was less to treat?
I actually saw equal response. Even looking at the before and after pictures for the first time to the second time to the third time, each time, I mean, I couldn't believe how much I lost each amount.
Yeah. It's amazing as we're talking here, I'm looking at you, I don't even remember, what it was like before. We'd have to look at, because right now your neck and chin look perfect. So, obviously it worked very well.
Because I'm looking at Amy, and she's a petite girl.
Yes.
So was it when you would look in the mirror or when you'd see pictures of yourself, did it make you look like you weighed maybe 15, 20 pounds more?
Yes, exactly.
Yeah.
And I got a lot of comments, have you lost weight? And I was like, oh, yes, I have.
I've lost 4 ounces right here.
Yeah, it really makes such a difference. Just looking at pictures, personal pictures at home, and then the before and after. It's like I said, it's day and night, really.
Do you mind sharing your age with us, Amy?
I am 30.
Yeah, she's young.
Yeah.
But, it's a great treatment for, young patients. She has beautiful skin and a beautiful face, but if genetically you just inherit a little bit of that heaviness of the neck, as she mentioned, it runs in her family, it's wonderful to have this option to treat it, without surgery, really.
Did you used to look in the mirror and just kind of like try to push it back or forward and just see like, gosh, I just wish, is that kind of where you were?
Yeah, I knew it was coming. It was just a matter of time, and I'm so thankful that I had this treatment, because I don't know how I would have gotten rid of it, really.
Yeah, so, liposuction works great for fullness of the neck, and I've done a lot of that over the course of my career. We do it a lot with facelifts, but isolated liposuction was something I used to do a fair amount just for that problem, younger people who had fullness in the neck, because it works very nicely for that. But got to say, nowadays, we don't have to do much of that anymore, because we can do this with, the Kybella or with the Cool Mini. So we have these great options that are non-surgical and really no downtime. Kybella, because it does rupture it, Coolsculpting seems to, the freezing triggers the cells to sort of gradually die and fall apart and be resorbed. So it's a little more gradual, probably not quite as fast as Kybella. As she mentioned, within a few weeks she saw a difference. And usually it starts around 2 weeks with Coolsculpting, and you notice over a month or so. But I think there's, in general, a little more swelling with Kybella. Amy didn't have a lot of swelling, which was great, but some people will have a pretty swollen. So that's one thing to be aware of. For that next several days, maybe up to a week, it's going to be pretty puffy, so it'll look worse before it looks better, because those cells are sort of all falling apart at once. But then it's resorbed pretty quickly by your body, and the contour is, greatly improved right away.
So other people in your family now looking at you and saying, gosh, I got to get that done.
Yep, my sister would love to get it. Yeah. I'm like, you're next.
The poster child now.
Right.
Right. Yeah. So it's nice. So we're seeing a lot of changes in sort of our approach to these things now, right? I mean, this is where, things are, you see the evolution of facial cosmetic surgery. And we use that as a generic term because the irony is that, a lot of the evolution is non-surgical. Right. Injectables.
And this seems like it would just be so simple. I mean, you just walk in to get a few injections and you look like you've lost 10 pounds. Right?
Yeah, absolutely.
How long did you feel, how long was the swelling visible for you?
Honestly, I'd say about 3 days. It wasn't bad at all.
That's good.
I was expecting much more time to be swollen.
Is this one of those things where you can put ice on to help, or it's just... Yeah,
it's kind of a little hard to do it because it's internal, and it's going to, you're getting that, disruption of those cells. So, it's sort of something you have to just, kind of deal with for a few days. But, it could be, 3 days or 5 days, but, generally it just resolves pretty quickly within a week.
Now, Amy's probably too young to already be having problems with the little bra fat in the back fat, right?
I don't know who doesn't.
But I mean, would you consider doing it in those? Because we're talking about small spaces that would be hard to get to.
Yeah, right now it's FDA approved for the neck. I don't know that they have any other indications yet. Obviously, as they evolve, we may learn more about other areas on the body. nicely. Obviously, that's something that's important to the company that now owns the product, and you will probably see some of that. Again, interestingly enough, Allergan Pharmaceutical bought the Coolsculpting platform and also bought the Kybella platform. So the same company owns both technologies.
Well, that
now.
makes sense.
So it'll be interesting to see how they position them, in the marketplace. I think they're probably spending a lot of time thinking about that. But, obviously there are areas, as we've illustrated just with Amy, where Coolsculpting didn't work, where Kybella was a good thing we had that. So we'll see how that's positioned going forward. They obviously don't work the same way, and so there may be certain patients who are better off with one versus the other. Time should tell.
Is it typical, like Amy said, she had a couple of treatments because she saw the results of the first and wanted a little more, and I know that happens with people who do Coolsculpting as well. Do you see that a lot with the Kybella, or does it just depend on the person, I guess?
You mean more than one treatment?
Yes.
Yeah, I mean, yes, because you get a nice response, and so most people will do more than one treatment with both technologies. I think kind of the way they've designed and work is, they're conservative, and they give you a nice contour, and you don't have to worry about over treating.
Right.
And so most patients would have more than one treatment, but some would do well with just one and don't need a second treatment. That becomes an individual decision.
Sure.
But if you get 60% of the result with the first treatment, most people are going to want to do a second treatment to try to get the remaining 40% or 50%.
Amy, are you happy with the results?
I'm very pleased. I was just thinking that actually. After one treatment, I automatically was like, this would be great to try again. And I'm really pleased.
Yeah, it looks amazing. So you've done really well. Thanks for coming in.
Yeah,
well, thank you for having me.
Sure.
All right. Well, we've been talking about Kybella in case you came in the middle, and we've got another patient who's going to come in, and next we're going to take a quick break here to talk about Coolsculpting. And I know that's a big buzz here in your office, is how to eliminate that fat, not just under the chin like we were talking about with Amy, but the rest of the body.
Right.
All right, we'll be back with more of Look and Feel Your Best with Dr. Patrick Flaharty in just a couple of minutes. I'm Gina Birch. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We're talking to a lot of Dr. Flaherty's patients this morning who've had things done like the liquid facelift and the Kybella. And in that last segment we were talking about Kybella, we kind of danced around Coolsculpting a little bit, and that's one of the craziest, coolest, pun intended, new treatments that you have here at. It's not really new anymore. You've been doing it for some time.
Yeah, it's not new, but it is evolving because the company has been great and very proactive about developing new techniques and new technology, and so it's evolved. The cool advantage is the new arm that is more effective. It's quicker and better results in less time, which is great. These now run for 35 minutes rather than an hour. But what Coolsculpting is cryolipolysis. It's fat freezing, and when you freeze fat to a certain temperature, it will destroy some of the fat cells. They'll actually go through what's called apoptosis, which is cell death. They just sort of die and gradually disappear and are resorbed by the body.
Okay.
And we got into this a number of years ago, and it's continuing to evolve, where we used to treat sort of lower abdomen and flanks mainly. Now we can really treat almost every area of the body, from bra fat to fat under the chin to inner thighs, outer thighs, back fat, inner knees, even ankles, if anywhere where people have this extra kind of deposits of fat they don't like, because we now have newer hand pieces that can fit these different areas.
Okay.
So today, I invited Tammy, who's been on the show before. Tammy's one of our estheticians, but she kind of fits into both categories because everybody at Azul has had Coolsculpting.
Right.
And if you see Tammy, you can't see her, but she's tall and thin and beautiful, and so you can't even imagine that she would need Coolsculpting.
But that's what's kind of interesting.
She needs to eat more, actually. We try to get her to eat more. But she's sort of experienced both sides. She does a lot of Coolsculpting treatment. She's not only a licensed esthetician, but she's certified through the Coolsculpting University, so she's one of our busiest Coolsculpting technicians.
So we're double dipping with Tammy
Double
today.
dipping,
All right.
getting her to talk on both sides of that. So.
So Tammy, you are one of these people who are thin and in shape, and why? I mean, someone would look at you and say, "Really, you have fat? You got to get rid of." So tell us your story with that.
Well, actually, I'm pretty thin because I've cool sculpted it all away.
Okay.
No, just kidding. I always say that if we can squeeze it, we can freeze it. The other thing is everything that I do to my patients, I have done to myself. I have experienced all of the treatments that we have to offer here at Azul on my. I like to be able to do that so I can describe what the treatment feels like to our patients. So one of the areas that I have worked on myself is called our banana roll.
What's the banana roll?
Oh, the banana roll is on the back of your thighs, just right underneath that gluteal fold.
Oh, yeah. Now, great. I've got one more thing to think about. Thanks, Tammy.
You're welcome. So I have treated myself on the back of my thighs. I've used our new Cool Petite applicator, which is indicated for smaller areas of fat. Like I've said, I don't have a tremendous amount of fat. So prior to Cool Sculpting coming out with the Petite applicator, I myself wasn't a candidate for Cool Sculpting. So that has definitely been beneficial to a lot of our patients that have a small area of tissue that they would like to have reduced. Cool machines. So I will typically have a patient on the machine for 35 minutes, one applicator on each side.
How did that feel when it was on the back of your leg there?
Well, for the first few minutes, you feel cold, and then it just goes numb. And we have you laying comfortably during the duration of the treatment. You're usually, we have you bring in something to read or something to do, your phone, things like that. But it's a very comfortable treatment. I really didn't feel anything. But the sensation of cold. The next day, I feel a little bit kind of like I did a heavy workout, just that sore feeling, but there was no discomfort at all.
So that's on the back part of your body. So when you were driving and sitting and doing stuff, it didn't affect your day-to-day activity?
Not at all.
Okay.
So actually, after Cool Sculpting, you can resume your normal activities. Sometimes the next day, you will be a little bit swollen, a little bit tender. But besides that, there really isn't any discomfort, associated with the Cool Sculpt procedure, especially with our new hand pieces that we have. That pain or that discomfort.
Yeah, Cool Sculpting, is an amazing technology, and I think these small areas are just this sort of untapped area, because people, I go to LA Fitness a lot, and when I talk to people there, they don't understand Cool Sculpting, but it's perfect for, these gym rats who are constantly like working on their body, but have a little love handles. And Tammy and I were talking before this segment just about, the difference between men and women, and I'd like for her to share a little bit of that.
Sure.
But sometimes, I don't need like body liposuction or whatever. And what really Cool Sculpting is in my mind is it's a body sculpting technology. You really can. I've had it done, as I mentioned before. And I work out a lot, but I'm in my 50s now, and your body starts to change. You start to accumulate a little more fullness in the midsection, and it just really kind of reshaped that part of my body in a very favorable way. So I really, and it's complementary to working out. It actually gets you more motivated because you're seeing more definition to your abdomen and everything. So it can be great for that person who's working out but just can't lose that little bit of fat in the lower abdomen, or for us men, the love handles, which tend to get a little bit bigger with age. So Tammy, why don't you share with us the different areas between men and women? And
very popular areas for our gentlemen are the abdomen, the flanks, or the love handles, as we call them. There's some areas that unfortunately we just have a harder time working off. And, with the Cool Sculpting, like Dr. Flaharty said, it really does accentuate your, already existing workout regimen. It can definitely motivate you to continue working out. Right. It enhances the results of your current, workout. But for the gentleman, with those small little, pockets of fat, the Cool Sculpting really does make a large difference on the love handles, the abdomen, there's, obviously other areas that gentlemen benefit from, but our most popular would definitely be the love handles in the abdomen.
How about women? What are the common areas for women?
Women, I've been cool sculpting from head to toe, well, head to knees. And I've been getting creative a little bit lately. I've had some interesting patients come in, some people with abnormalities.
Really?
Maybe they've had just one pocket of fat on one side, due to previous surgery or a scoliosis. So I will try to go in there and I will even things out. So it's actually, there's a bit of a finesse and a technique, and, I'm having fun with it. But the most popular areas for women in general would be the abdomen, the flanks, the bra roll.
Oh, yes.
And then the banana roll. And then right underneath that chin, the double chin, the submentum. But like I said, we can cool sculpt you anywhere from underneath the chin to your knees. Right.
What about inner thighs and knees? That's you guys talk about that a little bit.
Inner thighs and knees. Those are very popular places as well. We have been doing a lot of inner thighs and knees as well. Sometimes you'll get that little pocket of fat, right on either side of the knee, and we'll use our Cool Mini for that applicator. So we do have appropriate applicators for pretty much every area of the body right now. So if you come in, I am able to customize anything for your specific body type.
You can tell Tammy likes the cool sculpting. Yes, she owns that machine back there. So.
You cannot take it home with you.
But it's it's to have that passion for it and the artistic eye that she has, and is such a key thing because like I said, there's so much versatility with it. We're all different sizes and shapes, so there's no two problems that are identical, and being able to match the treatment to achieve the result is sort of a key thing. And often it's a series of treatments because once you shrink one area, then it alters the ratio, and so you'll treat another area to blend it in, and you're kind of gradually sculpting the body, which is really wonderful. You can do it a little bit at a time, or you can do it a lot all at once, depending on what your goals are. But it's a nice, very useful tool. And the working out thing. I mean, I've always worked out, and I almost got I'm in my mid 50s. I guess I'll never have the abs I had when I'm 18, and obviously I won't. But with this, it was amazing how much difference it made in my midsection. Just the appearance of my abs. It definitely motivated me to work out harder, because it's like now I'm cheating the system. I'm cheating Father Time, because I can eliminate the fat a little bit, and that further sculpts and improves it, and it definitely gives you a little bit more motivation to continue to work out, because you can see the results not only from your workout but from the cool sculpting as well. So.
Nice 1-2 punch there. Now, Tammy, you said if you can squeeze it, you can freeze it. Well, I can't squeeze my outer thighs, but I would like to freeze some of that. So I know Cool Sculpting has some different applicators for that as well, right?
That's right. So we have a special applicator for the outer thighs, and it doesn't draw the tissue into the applicator cup like some of our other applicators. It actually lays flat on the outermost layer of the skin. So that is great for things like our saddlebags, and we do a lot of those treatments as well. And what Dr. Flaharty was saying, I'm 42 years old and I have 3 little kids as well.
Wow.
And I'll never have, a perfect body, but, I did want to improve upon that one area. And so I think Cool Sculpting has really made the difference in the appearance of the back of my thighs. And I do work out. There's just some areas that you can't, you could work out all day long.
You just can't get them all.
That's right.
Yeah, that's right.
All right. So, Dr. Flaharty, thanks for lining up all of these patients.
Yeah, it was great.
Of course, Tammy, thank you.
Thanks, Tammy, for coming in.
Yeah.
Thank you so much.
All right. Well, if you want to learn any more about any of these procedures that we've talked about during today's show, you can get online at azulbeauty.com. You can also call Dr. Flaherty's office at 239-410-2508. Wait, that's not
415.
it. 415-7508. 415-778-76. Goodness.
How long have we been doing this show?
I don't know, but I just gave out someone's personal phone number.
You did. That was like your best friend, and they're going to hate you forever now.
Hello, Sarah, can I get some cool sculpting? No. All right, 415-757-76. That is the phone number to call. Don't call that other number. And we'll be back more next week with Look and Feel Your Best. For Dr. Patrick Flaharty, I'm Gina Birch.